The 2026 Kids in Sight Medical Mission is being celebrated for its impact. From January 19th to February 6th, a team from the West Virginia University Eye Institute worked tirelessly alongside local health personnel to provide life-changing interventions to children and adults affected by preventable and treatable eye conditions. This initiative was launched in 2003 and is a joint collaboration between the St. Lucia Blind Welfare Association, the Lions Club of St. Lucia, and the Visiting Institute. On Thursday, February 5th, the medical team, partners, and sponsors gathered at the Bay Gardens Hotel to commemorate the mission's successful conclusion. Director of Outreach at the West Virginia University Eye Institute, Rebecca Coakley, expressed gratitude for what they have been able to accomplish.
In 2003, our life changed. At first, I thought I was coming to St. Lucia, and my mindset was, oh my gosh, we're going to be able to help all these people. And I got to St. Lucia and realized that I got more than I gave. So the people of St. Lucia are beautiful. They are kind. Over the years, for the last 23 years, we've done about over 1,500 surgeries. Yes. We have done, we've probably done 2,500 eye exams, about 1,000 pair of glasses that we ship back. And we've seen many, many kids who are just low vision and blind. So, I feel like that we are committed to this island. This is part of who I am. I still have kids who, for the first years I was here, I still get messages on WhatsApp from them. And I've been here all week, and there's one keeps saying, Miss Becky, I want to see you before you go. I have one sitting in the front. And so it's always nice to see these beautiful smiling faces all grown up and being productive members of society.
Permanent Secretary in the Ministry of Health, Wellness and Nutrition, Jenny Daniel, lauded the various organizations for the impactful initiative.
Eye care, of course, is a very integral part of overall health. It promotes, apart from our physiology in terms of how we feel, but also it helps with our emotional and psychological well-being. As such, we cannot underscore the importance of maintaining essential healthy eyes or healthy eye care in St. Lucia. And so what you have done over the last week is very, very much appreciated by the Ministry of Health and the entire team. We appreciate what has the healthcare that has been delivered to our citizens, as well as the advice, the guidance, the training, and all the information that has been provided to us to help us to strengthen our position to partner with you as we move into the future.
The Tourism Enhancement Fund returned as sponsors of this year's program with an EC $30,000 donation. CEO of the St. Lucia Hospitality and Tourism Association, Nurani Aziz, explained that this decision was a no-brainer.
This year we were really impressed with the fact that the doctors have come down again, but apart from the kids, the program has now expanded to include adults as well. And so given also the reality that this need for attention to children with visual impairment and addressing the fact that it is affecting, for many of them, their ability to learn and function effectively in the classroom, created another synergy between another program that the SLHD's Tourism Enhancement Fund was financing. And so bringing them together also expanded the program to include another 34 kids from the Bocage Secondary School, with whom we were already engaged in another project to provide developmental support. And so tonight really serves as the culmination and handover of this financial contribution, which will be added to a pool of contribution from other partners that will go towards the Kids in Sight expenses in St. Lucia this year. We have been so impressed with the rollout of the program. We have been so impressed and inspired by the dedication of the doctors that are volunteering their time to providing these surgeries, that we're hoping in the near future to continue that support, expand that support, and maybe have multiple visits from the Kids in Sight project, because we understand that there is a growing pool of young people and adults in need of that corrective surgery and that attention to their visual impairment.